South Africa went into a hard lockdown in March 2020 in response to the global pandemic, seeing the country being put under various curfews and non-medical interventions, all in a bid to curb the spread of COVID-19. After almost 2 years, President Cyril Ramaphosa officially ended the state of disaster, however indicating that the pandemic would now be managed in terms of the National Health Act. Last month, the Department of Health published new draft regulations. The proposals will still allow government to have the discretion to decide on restrictions, not limited to curfew, sporting activities, lockdowns, economic activities, and sales of products. Measures will also be put in place to limit the number of unvaccinated people for indoor events. Mask mandate will also remain in place. The draft rules lay out requirements for self-isolation. Opposition parties have criticized the draft amendments.
Your department, through draconian intervention, want to just implement these things without proper consultation.
This is a mere way of allowing the government to continue with strenuous economic restrictions.
There's absolutely no point in making changes to an act that cannot be implemented.
Civic organizations have also accused government of attempting to control citizens.
And 4SA opposes the proposed changes precisely because we believe the draft health regulations to severely and unreasonably and unjustifiably limit various fundamental rights, including the right to religious freedom found in Section 15 of the Constitution, the right to freedom of association in Section 18, and the right of religious communities to practice their religion together in Section 31. Now, in terms of the draft regulations, the Minister can list any illness as a notifiable medical condition without public comments on the listing of such an illness as a notifiable medical condition, and without the Minister having to give reasons to Parliament as to why he chose to list such an illness as a notifiable medical condition. The draft regulations also only take into account how contagious a disease is and not how serious it is. In other words, it is theoretically possible that the Minister can choose to list something as contagious but benign as the common cold as a notifiable medical condition. And as soon as it is listed as a notifiable medical condition, all the limitations on our fundamental rights proposed by the draft health regulations kick into effect indefinitely.
Government has defended the draft rules.
If you regard this as draconian, then I don't know really to you what would be any public health measure. And that would be interesting for me to know, for us to know.
South African citizens have until next week to share their thoughts on the regulations. Hasina Gori, SABC News, Johannesburg.